what are the adverse effects of smoking tobacco? And they're actually pretty striking. I was surprised to hear that smoking is responsible for 1 in 5 deaths in the U.S. And to put that in perspective, that's more than the number of deaths from HIV, illegal drug use, alcohol use, motor vehicle injury, suicide, and murder combined. So it is a tremendous public health problem in the United States. That translates to about 480,000 people dying per year, 50,000 of whom are dying from secondhand smoke. There are studies that indicate that a business loses $3,400 each year per smoker from health cost and lost productivity, people taking smoking breaks, and that smokers miss 6.16 days of work per year versus 3.86 days for non-smokers. So those are some pretty startling statistics. There is evidence, a lot of it is anecdotal, but there was a study in New Zealand, a controlled study that indicated that people that smoked e-cigarettes had between a 50 and 75% greater chance of quitting smoking than people who tried other methods. And so there is at least some evidence, although it's not certainly by any means definitive, that e-cigarettes can help people quit smoking.
One of the things you hear from your employees or lawyers representing your employees is, well, wait a minute, e-cigarettes are at least as safe as cigarettes, but actually they're safer from a health standpoint. And the truth is, nobody can really say that. As John pointed out earlier, there aren't any good numbers, there aren't any good studies that can quantify whether e-cigarettes are more safe or less safe than cigarettes. And there are a number of challenges why we've been unable to do that. First of all, there are absolutely no industry standards. There's no quality control. So we can have vastly different purity or ingredients. A lot of these are available on the internet. A lot of the fluids are from China or overseas. There are no labeling requirements. There are no, we've got, John pointed out the FDA is proposing some regulations that are going to, they're going to hamstring in terms of labeling, disclosure of ingredients, but that's not in place now. And the truth is you don't really know what you're getting. So when an employee says, hey, these are better for me, and they're not a risk to my coworker who's complaining that I'm vaping, the jury's still out on that, and will be for some time. The other question, we get 70% of smokers want to quit, and they're telling, you're going to hear from employees, well, my best chance, I desperately want to quit smoking. My best chance to do that is to use an e-cigarette, and you are doing the wrong thing by not letting me vape at work or providing for a vaping location. Okay? Again, it's uncertain whether e-cigarettes are a good form of smoking cessation. It tends to be varies by the individual. And for some people it works, for others it doesn't. But here's to give you an idea of why you're very likely to be facing some of these e-cigarette questions in the next 12 months from your workforce. As of today, e-cigarettes are outpacing nicotine patches, they are outpacing prescription medication, they are outpacing every other form of smoking cessation device. More people are using e-cigarettes to stop smoking than any other method.